Hello, could you please introduce yourself?
Yeah, I'm Liane Feldman. I'm chair of the Department of Surgery at McGill University and surgeon-in-chief at the McGill University Health Center.
Why is improving surgical outcomes a critical priority in modern healthcare?
Surgical outcomes is one of our concentrations in our graduate program at Surgical and Interventional Sciences, and it really has to do with how do we measure the impact of new techniques or new processes of care, the impact on patients. So it's very clinically focused. We learn to use advanced statistical methods where we're really looking at the value of a new technique or new technology. Usually in interventional healthcare and surgery or in medicine in general, new techniques come along and they're often more expensive to implement. We need to really look at the value of introducing new technologies and new processes of care into our systems. Value is defined as the outcome divided by the cost of the technology. So in order to identify what the outcome is, there are many ways to look at that. It could be from the patient's perspective, using patient-reported outcomes, for example. There's a whole science about how we use that. It could be from the perspective of the clinical outcomes. So did it have an impact on the complications or morbidity of surgery? And we might be looking at the outcomes from the system's perspective. So what resources were used to deliver that care? So that might be things like hospital stay, for example. So all of those things are critical in how we evaluate the impact of new technologies that are always being developed in surgery.
What opportunities do students have to learn and apply advanced research methodologies in evaluating surgical care?
I mean, it's when we look at it, sounds intuitive. So traditionally, you might say, well, I started a new procedure, a new program, and I want to look at the length of stay and the complications. Those are traditional clinical outcomes. But as we feel that in the context of patient-centered care, it's very critical to have the patient's voice in that. For example, so one of our main areas of investigation is how do we measure the impact of new advances in surgery from the patient's perspective. So how do we use patient-reported outcomes as a measure of quality, for example, or as a measure of value? And these require more advanced research methods, advanced statistical techniques, for example, to be able to develop our own outcomes measures. For example, some areas we don't have good patient-reported measures. So to develop our own is one of our research interests that's been going on for a long time. Another area of interest is we look at how do we improve recovery from the patient's perspective. How do we measure recovery? How do we improve it? So multiple interventional studies like randomized trials that look at the impact of all the different elements of surgical care. One of our researchers is very interested in opioid avoidance or opioid sparing as a response to the opioid crisis that we have in North America. So that's one area of interest that of one of our researchers in the department. I've been very interested in what we call enhanced recovery after surgery. So looking at how we improve the process of recovery from the patient's perspective and from institutional perspective, from the system's perspective. So for example, we're leading a project on the implementation of what we call enhanced recovery after surgery pathways. We're contributing developing the audit, measure, and feedback database for the province to really improve our care at the level of our system and impact wait lists and patient access to the operating room. So I think when we look at outcomes research in general, it's pretty practical. It has the opportunity to really impact clinical care. We also look at improving quality improvement. That's another area of interest in our outcomes.
Can you share an example of how surgical outcomes research has improved patient care and the role students played in that success?
Absolutely. I mean, students are critical in moving everything that we do forward. So if we look at our graduate students doing outcomes research, they could do anything from audit that really could have an impact on the quality of care that we provide. So identifying where if we don't look at what we do, we don't really have a sense. We don't measure it. We can't improve it. So the first step is really looking at what we're doing. So that starts with, it could be as simple as a chart review, really bringing data forward. Students for sure are very involved in that. And then all the way up to, if you're a graduate student, master's or PhD student, it might be running a randomized trial and all the little elements that go into that, the funding applications, but then the research ethic board, designing the trial and actually running the trial. So for example, we have a trial that's funded, CIHR funded, that's from Dr. Fiore's lab, that's looking at opioid-free analgesia after outpatient surgery in some areas. So this was obviously has the potential to change practice. And without that kind of high level of evidence, it's very difficult to change practice. And even with that high level of evidence, it can be difficult to change practice. And that's why we look at things like care pathways to facilitate implementation of research into practice. So, and students are involved really at every level of all of those projects.
How does studying surgical outcomes prepare students for impactful careers in clinical research, policymaking, or healthcare innovation?
Yeah, I think they're just basic, really important skills to have in any kind of clinical research. I think the orientation that we have in our department is that it's very clinically oriented, so it's very practical. So we've had trainees in surgery that often choose to develop research methods, skills in outcomes because of the immediate clinical impact and how it's applicable across multiple fields. We have had many students that are interested in medicine or nursing or another clinically oriented career. So they'll have a master's or a graduate degree in our outcomes concentration, and then will be applying to medical school or to other clinical programs. Otherwise, I think it just prepares one to do any kind of clinical research, could be in an industry setting, or for other healthcare careers in hospitals, in departments of quality, for example. So I think it's a very broad training that is applicable very, very widely.